Okay, guys, here's your beef for you tonight or this afternoon. Give me a minute to set up for the show, and I'll be right with you, please. Give me 1 second. The article discusses the ongoing debate in England and Wales about legalizing assisted dying, highlighting the 5 key practical questions that need to be addressed before such a law can be implemented effectively. Okay, number 1, medication concerns. The report examines data from other jurisdictions, particularly Oregon, where assisted dying has been legal for years. It notes that the drugs used can lead to prolonged and unpredictable deaths due to inconsistent drug availability. In contrast, Switzerland uses a single barbiturate that leads to death within minutes, raising questions about what medications would be used in the UK. Okay, then there's opt-outs and service providers. Experience from Canada and other countries shows that many doctors opt out of providing assisted dying. In Canada, hold on, guys. In Canada, over 5,000 assisted deaths were carried out by just 80 people. Similarly, in the US and New Zealand, entire institutions, especially palliative care services, have opted out. The bill in England and Wales would allow hospices to refuse participation, which could make it difficult for patients to find willing clinicians. Impact on the NHS. The bill assumes the NHS would be responsible for delivering assisted dying, but concerns remain about whether the system is prepared for these new services.
We are unavailable to take your call. Please leave a message. Thank you for calling.
Okay. Let's see. Impact on NHS. The bill assumes the NHS would be responsible for delivering assisted dying, but concerns remain about whether the system is prepared for these new outside the healthcare system, new service. Switzerland uses volunteer doctors outside the healthcare system, which may be more sustainable. In the UK, oversight is expected to come from a panel including a senior judge or lawyer, a psychologist, psychiatrics, and a social worker. But the Royal College of Psychiatrics has raised concern about the availability of professionals to fulfill this role. Just a minute, guys. Okay, funding and accessibility. The impact assessment suggests assisted dying would be free at the point of delivery. However, palliative care, the alternative end of life supports, often receives less than 40% government funding and relies heavily on charity. This raises concern about a potential two-tier system where assisted dying is fully funded while palliative care remains under resourced. Okay, then you've got legal challenges and costs. If passed, the bill would face human rights challenges, particularly around mental capacity and access. Legal experts suggest several grounds on which it might be considered leading to additional costs. Families might also seek judicial review of a panel's decision to permit assisted dying in public protests outside clinics or hospitals offering the service could require increased security. This article emphasizes that while ethical debate around assisted dying are important, practical consideration must also be carefully examined before implementing such a law. Okay. Medications used in assisted dying vary by country, but barbiturates are commonly used because they slow brain and nervous system activity, leading to a peaceful passing. Secobarbital and pentobarbital numbutol are frequently used for physician assisted suicide or euthanasia. In Canada, assisted dying procedures often involve propofol and midazolam and Recumul with death. Okay. All right. Other page. Typically occurring within minutes. Switzerland primarily uses a single barbiturate to ensure a swift process. The choice of medication depends on legal regulations, availability, and medical protocols. In each in each jurisdiction, assisted dying laws vary widely across the world, with different countries adopting distinct approaches based on ethical, medical, and legal considerations. Countries where assisted dying is legal, some nations include Canada, Belgium, and Netherlands, Luxembourg, Spain, Portugal, New Zealand, Colombia, and Ecuador, and Australia have legalized assisted dying in various forms. And each and each in these countries, patients must typically meet strict eligibility criteria. Okay. Now, people, these are the rules for assisted dying in the appropriate countries where it is legal to do so. So, let's say a person lives in a place where it's not legal, but they have a terminal illness and do not want to suffer. So they have to move to a different country that offers this service for them. So I'll get into that shortly too after I switch paper. Give me 2 seconds, please. Okay. Such as having a terminal illness or experiencing unbearable suffering. United States assisted dying is legal in 10 states and Washington, D.C., but regulations differ by state. Oregon was the first to legalize physician assisted suicide in 1997, setting a precedent for other states. United Kingdom assisted dying remains legal under the Suicide Act of 1961, which imposes penalties up to 14 years in prison for aiding another person in ending their life. However, recent legislative efforts have sought to change this. Okay, Switzerland assisted dying is legal but must be self administered. The country has strict regulations to prevent abuse, and organizations like uh, Digenes provide assisted assistance under specific conditions. Next page. Give me a minute, guys. Belgium and Belgium and the Netherlands. These countries allow euthanasia for patients with mental illness or uh, danger, degenerative neurological conditions, provided they meet stringent requirements. India, France, and Germany, and South Korea. These nations permit passive euthanasia, where medical support is withdrawn for terminally ill patients, but they do not allow active euthanasia. Each country has its own legal framework, eligibility criteria, and oversight mechanisms to regulate assisted dying, ensuring ethical considerations and patient safety are prioritized. With what would you like details on a specific country's regulations? Okay, then we've got assisted dying is deeply debated ethical issue with strong arguments on both sides. Okay, guys, now, like I said, if a person has a terminal illness and they go to a specific state, specific country that offers this this form of end of life service, they have to meet specific criteria before they go ahead and do that. They have to be able to self administer the medication. They have to understand what goes along with the whole process of um, assisted dying for terminal illness patients, not just for recreational things, but for terminal illnesses, so that people can go peacefully and not suffer pain while process is happening. Um, some people they they do the debate thing for that reason, so that everybody that has to go through that understands the full process and the full reasoning behind having these guidelines in place, so that people have a better clear understanding on what it involves, and who specifically has this option when people have a terminal illness and they know that they're not going to get any better. They want to ease themselves into going. So some states offer assisted dying, but again, like I said before, they have to be able to administer their own medications in a specific state that is that the process is legal in. So you have to do some research and digging before you can go to that specific state. Like, you have to become a resident before you can do so. You can't just go and stay because you need, because the process is there. You have to become a resident first in that specific state that allows that. So those are some criteria that people have to jump through to get that done for people. Like I said, it's for people that have a terminal illness, first of all. So, with that being said, I thought we'd do a show on that tonight. Hope that helps somebody understand the process of assisted dying for legal battles and things. For now, Gator Wellness, take care, folks. I'll be back on with C shortly. Give me a little bit for C, please, and I'll be back on with you shortly. For now, Gator Wellness, take care, folks.